Interesting.
Well, hi, everybody. I am Dr. Una. If we haven't met before, I am the founder of EntreMD, where I help physicians build profitable businesses so they can live life and practice medicine on their own terms. I'm also the CEO of Ivy League Pediatrics, and we are in the middle of a COVID-19 pandemic, and there's a lot of financial implications and business implications for those that are in private practice. And today I have a very good friend of mine, Dr. Rogu, the amazing Dr. Rogu, and we're going to be talking about changes that we have to make to practices and how we're adapting. And hopefully you get some inspiration that you can add to what you're already doing to help you thrive in the midst of this pandemic. So welcome aboard, Dr. Rogu.
Thank you for having me. I'm far from amazing. I'm just a regular guy.
You're an amazing regular guy. How about that? All right. So can you tell the audience who you are, what you do, and we'll get into the meat of this.
My name is George Rogu. I'm a general pediatrician working at RBK Pediatrics and Urgent Care in Long Island, New York, the center of the epicenter of the COVID-19.
Yep.
Yeah. Right now, we're trying to pivot once again with this COVID-19, that big word.
Yep.
Yeah.
So how's that working?
Well, you know, it was just like, I'm sure in your town, everybody's scared. They don't know what to do. The sky is falling. Oh my God, what are we going to do? We don't have protective gear. I don't have telemedicine set up. People don't want to come in. I got to close the doors. I don't understand how people can close their doors. We're physicians. Did we not know in medical school that we're going to be exposed to illness? It makes no sense to me. Protect your staff. You know, get the right gear. Find the gear. You know, what we're trying to do is I think we still need to do well visits. We still need to keep children up to date on their vaccines because, let me tell you, we're going to get over this COVID-19 and then we're going to deal with other things, whooping cough, measles, varicella disease, rotavirus, all of it. It's coming back. You know, right now we're spoiled. We don't see these diseases. Lots of young physicians don't know what it is.
Yeah.
Yeah. So we have to keep these kids on target, but we can't just mix the patients up with the sick visits. We have to do something, make them feel safe. What we did is we segregated the visits. Morning checkups, only checkups. If you have a sick visit, you have to wait. Afternoon, only sick visits, so the well visits don't get mixed up with the sick and get ill. So that's what we do.
Are you getting any kickback from parents that have sick kids that are like, I don't want to wait till 2 p.m. for an appointment. I want to come in at 11?
At the beginning. But I think under the situation, they're understanding of it. And what we're doing is with those kids that really, really need to be seen at 11, we can do a telemedicine visit with them, either resolve their problem or tell them to come in later in the day.
Okay. And for the telemedicine for your practice as a whole, were you already doing telemedicine as part of your daily routine, or was this something that you had to add on after the COVID-19 pandemic started?
You know, I got lucky. I started it a little bit earlier, like in the fall of 2019, out of curiosity, I think. But I was doing it just for Ritalin renewals, controlled substance renewals. And I was doing more and more of them. I would do them in between patients and just put them in anywhere in the schedule. And the patients just loved it because they didn't have to make an appointment, drive to the office, park their car, sit in a waiting room, sit in the room until I get there, maybe get there fast, maybe get there slow, depending on the situation.
Yeah.
You know, and the one thing that I noticed with the telemedicine, especially the Ritalin renewals, they'll sit and wait for you. It's none of this. Everybody thinks they got an appointment. They got to be on the computer right away. Let me tell you, people will sit and wait. You're not going to make them wait forever, but they'll sit and wait. And, you know, telemedicine now is pretty sophisticated because, you know, they go into their electronic waiting room and then you get a ping on your Apple Watch that they're there. So you kind of like finish up what you're going to do and you mostly go down to a computer. You know, the problem that I have is the Ritalin renewals. It's embarrassingly fast. I do the exact same thing that I would do in person, but it is kind of fast. So I get to talk to the moms about different things of the day and whatever. You know, it depends on how you make your life. My template is perfect for this. I really, unless there's a medication change, there's not much to do. It's all written.
Yeah.
Yeah.
Awesome. Now, so you've talked about protecting your staff, getting the right gear, segregating visits, telemedicine. Any other changes you've had to make?
Um, for example, right.
Well, actually, no, I know a change that you've made. You have done a lot more engagement with your patients on social media. You've done more videos and more posts.
Yes, good idea. What's that about? I remember I told you about our clinically integrated network that I
Yeah.
made, the Independent Pediatric Collaborative of Long Island. So I became friends with these guys around. And I got frustrated with here, and we're texting now, and everybody's saying, I don't have gear, I don't have this, I don't have that. I discovered somewhere in Suffolk at one point they were given some face masks from the Department of Health. I immediately shared that information with them. They went and they ordered their stuff, and they should be getting some stuff. And then on Facebook that you're alluding to, I think one day out of frustration, I posted on Facebook, I can't believe everybody's hoarding these masks and my colleague friends have no masks to protect their staff. If they don't stay open because they can't protect their staff, they're going to close, as many did. And then you're going to be sitting as a patient, you're going to sit in an emergency room waiting to be seen. Okay, you're going to be covered with your face mask, but you're not going to have a doctor. So somebody donate some stuff to somebody.
Oh, I didn't see that.
Oh, you
That's
didn't see that?
cool.
Well,
Yeah.
that was a good one. And one of our patients, he was some kind of an environmental cleaning company. He came over, donated 100 masks to us.
No way.
Yeah. So I went to one of the practices that had a bigger practice that actually was forced to shut down because one of his employees was positive. So he had been closed. And then the staff, the hysteria and the anxiety that was within the staff, he couldn't stop the train anymore without closing the office for a week and a half. Then he's going back and he doesn't have masks. So they don't want to come to work. So we gave him the mask. Now he has masks to protect them. Then I went to a couple of solo guys, gave them a box of 10, another guy 20. Now everybody has enough for about a week. They can not share them, they can keep them for a week.
Yeah.
And next week we'll have masks. I'm sure we're gonna have masks in a week or two.
Okay.
Now, the other Facebook thing that you were talking about was you have to stay engaged with your patients, okay?
Yep.
Right now, everybody's bored. All of the moms are on Facebook. They have nothing to do. So the easy job is close your office. Everybody's complaining, there's no volume, I got nothing to do. Tell your patients you're still there, you're seeing the patients. So every day what we're doing is we're getting like a 1 or 2 minute video clip just from the hip about something. One of the popular doctors did a little clip on how important the vaccines are and what happens if you delay. People watch it. And then we end it with, remember, RBK Pediatrics is here for you. We're here until 10 o'clock at night. If you're sick, call us. We'll see you. We'll do a telemedicine. We didn't forget you. We're here. One of the doctors wanted to, yeah. So every day there's a video going and we're continuously just pumping it out. We're sending it through our communication software. And I have one of these, my problem was there's a lot of stuff to do. And I got to see patients. I got to do this. I got to manage. I just can't make things. So I got one of the young college kids that works for us. She sits next to me. And every time I got an idea or something, I say, I need to do this, this, and this. Here's a video. She'll make a nice presentation and put it and send it away.
Great.
And it goes much faster.
Yeah.
You got to delegate these things.
Delegate. Okay, yeah. Good.
And then we're putting these videos also to the Facebook community mom groups. And
are you a part of the community mom group, Dr. Rogu?
Somehow.
I'm just asking here.
Somehow I am. I don't know why they let me in, but you know what? It's fine. We're in a community. And then people hear about that. And and you stay in the know. You stay in their way, and then when they need you, they'll call you.
Okay. Okay. That's brilliant, actually. Okay. So to recap, we need to protect our staff to keep our staff coming to work. And we need to segregate visits. And that could be well in the AM, sick in the PM. Embrace telemedicine. Do it like you mean it. And then engage with your patients because they're
And
there, they're bored, and you need to be top of mind.
have to be top of mind, and also engage with your community physicians around you.
Ah,
Or,
okay. Tell me more about that. Like what
with
you did with helping them with the masks and things like that?
the mask, I didn't have to do that. We had
Yeah.
plenty of masks. I could have kept them, but I wanted to help them because I need them to survive. I want them to survive. And actually one of the doctors that's a solo practitioner, we exchange emails, all of us, ideas on what to do, how to test. When that example with that doctor that had to close his office, when he was closing, we just came down with the information that you don't no longer have to close your office if somebody has positive. It's the New York State regulations.
Yeah.
So we sent it to him, but the whole mindset, the hysteria, the anxiety, he couldn't stop the staff, so he had to shut it down to clean. But at least he didn't close it for as long as he was supposed to initially, because he knew the regulations were different. So somebody always knows something. So if you have a question, you ask the group. And one of the doctors that was a solo practitioner, she says, thank God for this little group of ours, because I feel like I have people around me to help me suffering through the same thing, as opposed to just me figuring it all out by myself.
That's really powerful. So don't isolate.
Don't isolate.
There's so much power and information and support in the team, in the group. So engage with the community physicians. That's really
Correct.
good.
Yes.
Okay, so I have one more question for you.
Sure.
If someone had, like I only saw 5 patients in the office, and I wanted to do telemedicine. I don't even know how do I get patients aware of that? How do I pick a platform? Like, what would you tell them? This is someone that doesn't know where to start.
You have to pick a platform. There's plenty of platforms out there, paid ones, free ones. Find one that you can figure out and use quickly. And then once you do it, you have to start emailing your patients. I'm doing telemedicine. This is how we do it. This is the product we're using, and engage with us. Again, communication is very, very important.
Yeah.
Like my video that I'm going to do now is explaining how telemedicine is working. Telemedicine is good. I'm old school. I still think patients need to come to the office, but I've done a lot of telemedicine. I'm doing more telemedicine sick visits in our practice, but I'm also doing some of this direct to consumer telemedicine, just more to figure it out, to practice with it on people that I don't know. And it saddens me when I hear of people that they have no doctors to go to because their doctors closed in the Bronx and in Brooklyn and in Manhattan. And, they're calling me so I can write them a Preventil refill. That's pretty sad.
Yeah.
And a lot of the telemedicines that I have on the teledoc thing, many times I'm telling them you should see your physician in a day or two. Many people don't know. So that's a hard one for me to understand. People are closing. They're just closing up shop.
Well, now you're telling them to reopen. You're part of the empowering community.
They have to reopen. They have to be there a little bit. But people need to feel that you're doing something to secure their health. Clean your office. Let them see. Let your office smell like Lysol. Let them see the nurses cleaning the tables. Segregate the visits. Have them come in the afternoon when they're sick. Let them wait in the what is it called? In the car.
Yeah.
Not in your waiting room. Yeah. But telemedicine, I'm not. It's the future. There's no way around it. There just is no way around it. And I did a visit yesterday. That the scenario was one of the younger doctors gets a call. The 13-year-old fell down skateboarding. The mother wants to get an X-ray. She does not want to come in because she's afraid. So the guy was going to send a prescription to the radiology place and be done with it. Now, many versions of wrong with that mentality, okay? From medical reasons to business reasons. So I said, stop right there. We got her hooked up with one of the telemedicine visits. We get her online right away. I said, let me teach you how to do telemedicine. So we sit down, we start talking. So he does his regular doctor thing. And we asked the mother, show us your arm. So she shows us the arm. You can do that. You can see pretty good.
I can see your arm.
Yeah, it was deformed. It was a little deformed. You can see it. I asked her, put your fingers gently and squeeze. The kid jumped to the ceiling. Point tenderness. Needs an x-ray. All right, so you're going to get an x-ray. You got now, you can't just walk in to get an x-ray these days. You need an appointment with these guys. Got them an x-ray. We knew it was going to be broken. While they're getting their x-ray, we got the results. And then it was Salter 2 fracture through the growth plate. Needs an orthopedist. I texted one of the orthopedic physicians that I know. I told him, what do I do with this case? It's 5 o'clock in the afternoon. He says, let me log in and see the x-ray. He logged into the radiology portal, saw the x-ray, and he told me, tell him to rest it, ice it, elevate it. Tomorrow morning at 8:30, come to my office and I'll put a cast on it. Follow up today. The kid did well. They put a cast and everybody's happy. Now, that was a successful telemedicine visit. It was successful also business visit because initially he started off, let me do a phone call and take care of it. The end result probably would have been the same with a lot of work and a lot of aggravation and a lot of drama. And, now they're paying for telephone visits. He would have made a whopping $10.
A whole $10. What is he going to do with that?
But it was a life lesson for this doctor. Now he understood.
Yeah. Yeah.
Oh,
And
yeah.
that's a powerful lesson because we have to balance the two, the medical care we offer and then the business care because we need to keep the business alive.
We don't have visits. There's no visits in the office. I mean, we're still with some visits, but we're downsizing on the doctors and we're downsizing on the staff a little bit, not to the point of firing and getting rid of. We're making the A team and the B team to spread it out a little bit until this thing is all over. But you still got to pay rent. You still got to pay vaccines. You still got to pay the staff.
Yeah. Yeah. Okay. Well, I think this was really helpful. This was a number of really great tips. And then, if people have questions and all that, they'll ask and then we'll take it from there. But this was really good.
All right.
And I'm sure you're thinking like, I've seen things like this before. I survived 2008. We'll ride this and we'll be fine.
Doctors at the end of the day are always fine. They're always fine. I mean, this is the first time I've ever seen where there are no sick patients, but they have to be, they're just not coming.
Especially in pediatrics, right?
I know they're going to be coming once they get back into the normal school and daycare and all that kind of stuff. And, they need their paperwork for school to go to school and vaccines and sports. People are going to bang on your door and there's not going to be room for them. So I think this is all a temporary, I pray to God it's a temporary thing. It has to be a temporary thing.
Yeah. Okay. Well, this was good. Thank you. Thank you. It was lovely having you here. And maybe we'll get to do this again.
Yeah, sure. Anytime.